everybody, it's Dr. Deom here at Hazleton Eye Specialists, coming to you at 281 Airport Road, Hazel Township, Pennsylvania, 18202. Telephone number 570-453-2020. We also have our brand new Tannersville location, formerly in Stroudsburg, now in Tannersville. And the location for that is 2942 Route 611, Suite 5. Tannersville, Pennsylvania, 18372. Telephone number there is 570-421-3342. Beautiful new location. If you haven't checked it out yet, get out there today. Really excited. I got my fuzzy eyeballs on. So we're talking about children's eye care again, and I have some wonderful friends of mine here. We got Adeline. She's going to be coming in and out, and that's totally fine. We have one of my great friends, both of my friends here, Megan and Joe Natale, and really happy that they're here with me today, talk about the importance of children's eye care. So what we're going to, we also had a little show recently about infancy with my daughter, and talked about the importance of infant eye exams. And what we have here today is sort of a continuation of that. So we are going to sort of re-discuss the importance of infant eye care. And here we have Adeline, who is a product of an infancy eye exam and has her glasses on here today. So what we're going to do first is we're going to talk about infancy. Okay, so infancy again is a free eye exam, comprehensive eye exam for children between the ages of 6 months and 1 year of age. And so if you're out there, you have a child who's between the ages of 6 months and 1 year of age, for any reason, bring them on in for a comprehensive eye exam. We're going to find out whether they need glasses or whether there's anything there that we need to follow. So I'm going to switch it over here to my good friends and ask them, as new parents, what did you know about infancy? Did you know about infancy? Did your pediatrician tell you about infancy? How did you learn about it?
I really learned about it from you.
Okay, fair enough.
Yeah.
Guilty as charged.
We're both patients.
I don't think I remember going to the eye doctor until I was in grade school. So you had encouraged us to take her for an exam, and that's why we came.
Yeah, and that's right. So I think with that experience in mind, you think about the importance of children's vision and their development, and the importance we place on it in our pediatric regular well visits in pediatricians' offices. And what happens in our pediatrician exams? What happened with her and her pediatrician? Do you remember what they did with her eyes? If they noticed anything?
I think they just looked at it with the light just to make sure she was looking correctly, and just the basics.
Right. So, no problem. That means she can see well. She's walking around. Everything's good.
Right.
So,
That's right.
So you're right. The main thing that we do in our pediatric setting for checking vision and eye health is a quick look at the eyes with something called an ophthalmoscope, which is a really basic view. And then the other thing is something called a fix and follow, where we move a light in front of the eyes and just watch the eyes move. So we did. We had her come in, and we did a quick little infant eye exam. And I think I mentioned to you at that point, guys, I'm finding a pretty significant prescription.
Yeah.
Nothing we're going to do anything about at this point in time, but what we're going to do? We're going to follow her. Because a lot of times we will find pretty high prescriptions in children. However, not so significant that we need to do anything about it. And a lot of times they will normalize. They'll go away. As they get older and they grow, they'll actually go away. So we did. We had you guys come back. So tell me, what were you thinking when I said that? What kind of went through your head? What were you thinking? Tell me the honest truth. I don't think I've ever asked them these questions before. So.
I was pretty surprised because I was surprised that she would have such a high prescription that young, and that she would need that.
And both of you have glasses.
That's true.
So you also know what it's like to wear glasses. And I think there was a conversation like, was it like my prescription? Or, and I communicate to you, well, actually it's 2 to 3 times what your prescription is. So, what was that like hearing that? What did you think?
Well, I wouldn't say we were surprised altogether because we both have glasses. We both have big families where everybody has glasses for the most part.
Right.
So we knew that she would probably need glasses at some point.
Right.
I think we were just surprised that she needed them so soon.
Right.
And I think the whole infancy program altogether is very interesting because you think, like, I go to the eye doctor, I read the letters or the numbers off the board. How do they tell what she needs if she doesn't even know letters yet.
Thank you so much for bringing that up.
So I think that in itself was super, not pun intended, eye-opening.
Oh, thank you. I love it.
So it was one of those things where I felt like it was a really good thing for her.
Yeah, great point, and good thing to bring up for everybody watching, because the whole thing about infancy is that we don't need the child or infant to respond. We're able to actually tell objectively. That means without the child responding to us in any way, whether or not there's a significant prescription that needs to be corrected, and we were able to tell that right away. And so what we did was we had you come back several times. I think we saw you maybe 3 times within the first year and a half of life. And at that third visit, I said, you know what? We're there. We're at a point where I'm not seeing a change, so we're going to go ahead and get this prescription. And it was really interesting having that experience with you guys, because you're friends of mine.
Yeah.
And I really, not that I don't take every prescription I write very seriously, but it was a different experience, and I really wanted to make sure we were on the right page. But that's sort of the mechanism that I've adapted as we've gone forward here. So come on over, Adeline. Come on
Adeline.
over. Take a look in the camera.
Adeline, do you want some of my fruit snack?
It's all right.
I got fruit snack.
Good.
Careful, watch your feet.
So now what we do most often is when we do find a really significant prescription, especially in one eye or even in both eyes, but especially in one eye, we're going to want to check and make sure that patient comes back and see if that is a repeatable result. Because like you said, how do you know?
Yeah.
How do you know? And the child can't tell you. So we want to check to make sure that's a repeatable result. So we'll have them come back in 3 months usually and check that again. And the reason we're doing that is because of something called amblyopia. Amblyopia is a medical term for something that used to be called lazy eye. Okay, and there's 3 types of amblyopia, and we're going to talk about that in our next section here. And had either one of you heard of amblyopia before? Any family members that have amblyopia?
No.
Right.
No.
Right. So it's something you don't really hear much about. I think you hear about a lot of common childhood conditions. Amblyopia is a very common condition. 1 in 4 children actually have some sort of corrective vision issue, and anywhere between 10 to 15% actually have amblyopia. So it's actually a pretty common thing, and definitely can affect our ability to learn, our ability to develop, and our ability to develop through school. So we're having a blast here today, Hazleton Eye Specialists. Adeline's running around. She's loving it. She's enjoying it because nobody is in the office here today, but we're having a good time talking with her parents about the importance of early eye exams, in particular infancy, a free eye exam for children between the ages of 6 months and 1 year of age. So we're going to come right back and we're going to talk a little bit more about amblyopia, what it is, and why you should know about it. Hello everybody, again it's James Deom here, Dr. Deom at Hazleton Eye Specialists. 281 Airport Road, Hazel Township, Pennsylvania. Come on in, stop us out. We also have an office location in Tannersville, brand new location. We used to be in Stroudsburg, now we're in Tannersville, brand new location, large optical, beautiful facility. Check it out. It's at 2942 Route 611, Suite 5, Tannersville, Pennsylvania. Check it out, beautiful location. So you see me, I got my fuzzy eyeballs on today, so you know we're talking about children's vision and the importance of children's vision. And I'm here with my great friends, the Natales, Megan, Joey, good friends of mine, went to high school together. We're Hafey grads. He's not a Hafey grad, but we'll let him in on this anyhow. And we have their beautiful daughter, Adeline, here today as well, who I have the pleasure of being her eye doctor. And we're here today. Right now what we're doing is we're going to talk to you a little bit about amblyopia. Okay, and we've talked a little bit about amblyopia and the different types of amblyopia. And we were just mentioning before, you'd not heard of that before, right?
Yeah.
Now, when I say, hey guys, it looks like there's some amblyopia going on. What were you thinking when I said that? Was that spooky? Were you concerned? Did you research it? What were you?
Well, it was kind of like, I've never heard of that word before.
Right.
So, yeah, it was kind of startling because you're like, okay, is that serious?
Right.
I don't remember searching it because I remember trusting you in your medical profession.
Well, I appreciate that.
You're welcome.
I think I encourage, parents to go out and do some, pertinent research, and we look at Google websites and we go out and we do, mommy blogs and things like that. We get in a little bit of trouble. But pertinent, research are things where we're looking at, medical websites or hospital websites and things of that nature. We're looking for definitions. We're not looking for alternative treatments and things like that. So, but I think what you mentioned was that, you trusted me in my opinion, and I think probably that had a lot to do with the fact that we were watching her, and I was giving you little pieces of information as we were going along. So Adeline, we got some glasses for you. Come tell me about your glasses real quick.
You want to talk to them about your glasses?
Come tell me about your glasses. They're so pretty. They're beautiful purple glasses. And I think, that's another thing that a lot of times people wonder is they say, well, how am I going to put my rambunctious little 1 or 2-year-old in a pair of glasses? How is that going to happen? And what you'll see here with Adeline is that she has these beautiful little glasses on. They're made out of a wonderful plastic, and they're made by a company called Miraflex. And Miraflex makes these frames that are just almost indestructible. This is your second pair, correct? And how have they held up for you?
Oh, they're great. I wish they made them for adults. Because
actually, they do make them for adults.
I always thought they'd be great for...
Yeah.
But they're super durable. They held up. We only got the second pair because she needed a stronger prescription.
Right. So what she said is basically, they hang in there, they're tough, they're durable, they're reliable, and the nice thing is they have this great strap in the back of the head, so that they, as they're running around and being kids, which is what we want them to do, those glasses aren't going anywhere, and the other thing is we're fully equipped to have children here. We love kids running around having a good time. We don't mind it at all. It's just part of what we do. So, and that's part of the reason we're here today having a good time with Adeline coming in and off and on the set is because it's come as you are. We want you to come. We want you to be comfortable. We want you to feel at home and part of our family here. And that's why we're doing the show like we're doing it here today. So amblyopia, a little bit about amblyopia. So we talked a little bit about, what it was that they knew about it. Not much. So there's actually 3 different types of amblyopia, okay? And the first type of amblyopia is very rare. It's called sensory deprivation amblyopia. Usually this is from when a child is born with a cataract. Very, very rare. But basically what this means is that light from the world isn't getting to the back of the eye because the lens is foggy and it's filtering out the information. So that's the first type, sensory deprivation amblyopia. The second type is something called refractive amblyopia. And that's the type of amblyopia that Adeline would potentially be subjected to if she had not gotten glasses, okay? So this is the type of amblyopia that is actually avoidable. And that is one of the big points of infancy, is that this is an avoidable condition. And the reason for that is because if we get the correct vision, the clear vision, to the brain by way of clearing it up with glasses, then there's not going to be this miscommunication between the world and the brain. So refractive amblyopia can be in both eyes or even in just one eye. Now, one eye is a little bit harder to pick up on because as children grow, they see very clearly, they do very well in school, and they aren't able to communicate whether or not they're not seeing clearly. So with Adeline, we actually found that she had a very high prescription in both eyes. So that would be a potentially amblyogenic prescription in both eyes. So I think this would have come out at some point in time, but maybe not right away, okay? And the last type, the type that we actually probably see children for most commonly is strabismus. And strabismus amblyopia happens when there is an eye turn, okay, where one eye is turning in or out. And you can actually get an eye turn with a refractive amblyop as well, when somebody's very farsighted. So with Adeline, actually, she had a very high farsighted and astigmatism prescription. So did you notice her having any eye turn at any point in time?
We actually did notice it, but it was right after we had gotten the glasses. And for me, that was when it was like, this is serious. We need to make sure she wears them. And,
right.
And she did wear them. And once she put them on, we didn't notice that any
Right.
longer.
Yeah.
But we were noticing it, and family members were noticing it, that the one eye was sticking in.
And that was right when we ordered them, but before she got them.
Yes.
Right? Yeah, so it's kind of like perfect timing.
Both grandmas noticed it.
When grandmas notice
Both grandmas noticed it.
Parents, you gotta act.
Nona
all right?
and Mima
That's the
noticed.
bottom
They
line,
saw
right?
your
We
eyes.
know when grandparents, they start. You know, we gotta do
they
something
noticed
here.
it.
So we're talking about amblyopia. We're talking about infancy, the importance of child eye exams. We're here at Hazleton Eye Specialists and Stroudsburg Eye Specialists. If you have a child out there and you're concerned about his or her vision, or if you just want to know about their vision, please give us a call. Telephone number 570-453-2020 in Hazleton, and our Tannersville office is 570-421-3342. Thank you. Hello, everybody. Dr. James Deom here at Hazleton Eye Specialists. 281 Airport Road, Hazel Township, Pennsylvania. Telephone number 570-453-2020, and our brand new office location in Tannersville. So excited about it. Really want you to come out and check it out. Wonderful frame selection, beautiful location, great technology, great doctors. Tannersville, Pennsylvania. It's at 2942 Route 611, Suite 5, Tannersville, Pennsylvania. Telephone number there is 570-421-3342. I'm here with my little buddy here today, Adeline. Adeline, do you love your glasses? Yeah, she said yes. She did. I heard it. She said yes, and got a big smile. I'm here with her wonderful parents, great friends of mine, the Natales. And I have Megan, a high school friend of mine, and Joey, also a high school friend of mine. And we've been able to stay friends here. And really a great story that we were able to help out Adeline with some new glasses and help her develop along the way. And so just to catch everybody out there, we talked a little bit about infancy, the importance of early childhood eye exams to complement what pediatricians are doing in their offices. And we also talked about not to downplay what pediatricians are doing. We think that what pediatricians are doing are great, and you know, they are checking a lot of very, very important things. However, I will say that we can add upon that, and most of the pediatricians in our area, if not all of them, are extremely receptive to the infancy program. So, you know, we're able to work really closely with them. I send them a letter, let them know what we're seeing, what we're doing, and they're loving it because we're helping them get more information about the child and helping them develop and evolve throughout their really important years of life here. So we talked about that. We talked a little bit about amblyopia and what it is and different types of amblyopia that exist, and the importance of avoidable vision loss by early correction of glasses, and that we can find a prescription in glasses with a child who, you know, would be bouncing around a room, and maybe you think, you know, boy, there's no way they're going to sit still to, you know, get a light in front of their eyes. There's no way they're going to sit still. But you know what? We break it up in chunks and maybe have you come back and we get that information. And with Adeline, it took probably 2 or 3 visits until we decided we were going to get those glasses. So that takes us up to now. And Adeline's how old?
2.
She just turned 2 in
Just
August.
turned 2. Happy birthday, Adeline, right? And how's it been? What have you noticed with her? And it's so hard to say because children change so much rapidly every day. But before the glasses, after the glasses, are you able to notice any change with anything in particular? Do you think the glasses helped? What do you think?
I think they definitely helped, and I think the biggest thing was her walking. She never crawled. She scooted really late, and then she didn't walk till around 18, 19 months, which kind of coincided to right when we got the glasses. So
Yeah.
we think that maybe had something to do with it.
And you can see she's walking perfectly fine now. Yes. Okay? In fact, she's a runner, just like Mom. Mom's an avid runner, and Dad is too. You know, we're really happy that that's where she's at. So I want to go back to when we first got the glasses. And you may have seen out there on Facebook or different social media posts when a child first gets their glasses. I get tingles thinking about it. It's like this magical moment. It's this magical moment when, boom, the child lights up and boom, that's right. And the parents cry and there's fairies and unicorns and rainbows, and it's just this magical thing, right? And so I discussed this with them. I said, don't worry, it's gonna be great. And they're like, well, I'm a little worried, you know, I don't know if she's gonna like it on her face and on her head, I don't know. And I said, no, it's gonna be great. If it works and she likes it, it's gonna be great. So we put them on and we try it out, and what does she do? She screams. She takes them off, and it was a little bit of a not what I had promised, and so we're a little bit, that was a little bit of a setback.
Yeah.
And but I was so happy that the parents stuck with us. They believed in what we were doing, and we had those 3 visits of repeatable data, prescription that was the same every time, and we said, this is really important. Let's stick with it. Let's keep at it. Let's keep going with it. And she'll eventually, see, wow, this is great. I can see things so much better now. So how long did that take? What for you? And the experience is different really across the board for kids. I will say more often than not when I have a high prescription in a young child that they do take to it right away, but not always. And it's important that we keep with it. So how long did it take? Do you guys remember?
Take for her
to wear the glasses.
to wear the
To
glasses.
really just, to be like part of her fabric.
Like
Probably a couple weeks.
I think it was quicker. I think it was quicker
I think
because it
it
was a
was-
routine. I think children like routine.
Yeah. And so what is it like now?
It's
now
like,
they're just-
It's just like getting her dressed.
And
If
does
we
she
pull them up-
toss them on, or do you guys give them to her? Or?
She's been wanting to put them on herself.
Yeah.
Sometimes she does it right, sometimes she doesn't.
Yeah.
But she knows that she needs them, and if
Yeah.
I pull them up to wipe her face, she pulls them right back down.
Yeah.
She wants them on.
It's a lot of fun, to see that evolution and to go from, oh boy, this is something foreign and maybe a little bit scary, and I think that this is something that I don't want on my face, to all of a sudden, wow, this really makes my world easier to navigate and live in and walk and talk and just so many things in our world are dependent on our clear vision of the world, right? So many things in the world. Your friends at school, right? Learning, colors, walking, talking, eating, all those things are very important, and you need to be able to see clearly to do those things, right? That's right. And so that's why the glasses are so helpful, and really takes a team approach. It takes parents that are dedicated and caring enough to bring their child to come and get these exams, to believe in the healthcare provider, to know that this is something that's going to be beneficial to them. Because while we mentioned the grandparents talking about the eye turn, there's also some pushback from family members, not saying you guys, but I've had experience where some family members will say, well, what are you talking about? Mm-hmm. That kid needs glasses at 1 year old? How do they know? Is that going to hurt their eyes? Are they going to be dependent on them then?
We get that question from strangers all the time. They say, how did you know that she needed glasses that young?
Right.
I mean, we get it all. I get it all the time.
Right.
Oh yeah.
From people.
Yeah, and those are real concerns that people have. They say, is this going to make my child need glasses? And the answer is no. That it may be that she grows out of glasses. With Adeline, with Adeline and her level of prescription, it is unlikely that she'll grow out of it, but it is possible. It is possible. And so, the way in which she could do that, though, is by having the right prescription and by being able to, see the world clearly with those glasses. So moving forward now, what we'll continue to do is check her eyes, her vision, her prescription every 3 to 6 months. And by doing that, we're going to be able to tell whether things are changing, they're normalizing, what they're doing. The next thing we're going to be doing is looking at how our eyes are working together as a team and moving. And there's something we'll talk about in a further show called vision therapy. Vision therapy expands upon just 20/20 vision. 20/20 vision is very important, but as we age and go through the learning process, we start to need the eyes to work together as a team, to be able to read and to be able to learn to read and read to learn, right? And so binocular vision, your eyes working together as a team, is very important. And children and adults with amblyopia have a little bit of a harder time with that. So as time goes on, we'll start to look at different ways that we can integrate eye movements into helping Adeline's and many other children's binocular vision, so that they're able to read and be at all the other grade levels that they should be at. So I want to say thank you from the bottom of my heart for my good friends and Natales. for coming out here today, talking to us about their wonderful child, Adeline, her eyes, and her journey with glasses. It's been a wonderful experience. I really, really thank you for allowing me to be part of it. It really is so amazing to have people that know me, trust me enough to bring their children and their own eyes to me. I don't take it lightly, so I really thank you guys. And I thank you, Adeline, for being my buddy. And I want to let you all know, if you have a child out there, newborn, 6 months, 1 year of age, infancy, free eye exam, comprehensive eye exam to determine how your child's doing. Bring them on in. Thank you very much and have a good one.